So Barry, what about a patient who presents with a bad headache and feeling dizzy for a day or two?
So it depends if this is the first episode or not. If it's recurrent, and patients had many of these episodes in the past, over the last several weeks or months, actually your anxiety can be allayed. It's almost certainly vestibular migraine because of its recurrent nature. If it's first presentation of a bad headache, particularly if it's occipital with vertigo, with or without nystagmus, I'm afraid to say, first onset vertigo with bad headache, there's a high risk of this being a stroke. Some cerebellar strokes can present without much nystagmus, but the patients do have gait ataxia. So what are the red flags here? Mm-hmm. Particularly if the patient describes hyperacute onset to the symptoms, particularly if it was associated with a Valsalva maneuver, then you are thinking, is this an embolic cerebellar stroke? These patients will describe severe vertigo, they will have gait ataxia, they might not have nystagmus. The differential diagnosis of this, of course, is the first presentation of vestibular migraine. Irrespective of that, given that it could be a posterior circulation stroke, and bear in mind that 40% of patients with posterior circulation stroke have headache, typically occipital. With the first presentation, you cannot reliably exclude one or the other in your practice. So in that case, these patients need to be referred on